close your eyes. I'm going to place an object underneath your nose, and I want you to take a smell and tell me what it is, okay?
Coffee.
Coffee. All right. Go ahead and smell that for me.
Lemony Snicket candle.
A lemony. All right, you can go ahead and open your eyes. Good. Alrighty. I need a flashlight and a tongue depressor for this. Alright. So I'm going to start off by having Lincoln stick out his tongue. And I've got a homemade fashion tongue depressor here. I'm going to check for a gag reflex. I need you to say ah for me.
Ah.
Alright, good. I'm observing for gag reflex. I'm also observing the tonsils, making sure that there's no swollen adenoids, making sure that there's no bleeding of the mouth. I'm also observing this tongue, make sure its integrity is intact, and also observing for any dental caries or anything along those lines. If you would, I have a little bit of water here. I'd like you to just take a sip for me. Alright. Observed him drinking the water with no issues. He's got a swallow reflex that's intact, so I'm not worried about any issues there. At this point in time, I'm going to look at his neck. Go ahead and put this away. Alright. I'm going to have you lift up your head, just kind of look at me. I'm going to inspect and palpate the neck, again, assessing for all the different skin issues I need to be concerned about, characteristic, texture of the skin, discolorations, things like that. I'm also going to be observing for making sure that there's no JVD, making sure that trachea is midline. I'm going to go ahead and have him swallow again. And that seems to be intact. I'm also going to be observing his lymph nodes. I'm going to be starting with the preauricular, postauricular, also the two cervical chains, the anterior and posterior, and also the supraclavicular. So starting back here, observing all the different lymph nodes as mentioned before. And then moving on to the thyroid. Lincoln actually had his thyroid removed last year, so we won't be able to observe that, but we do notice that he does have about a 4 to 5 centimeter scar right across there. And then we're going to test for range of motion of the neck. Go ahead and turn your neck on a swivel just like that. Okay, good. What I'm going to do is I'm going to place my hand against here. I want you to push against it with resistance. Excellent. Go ahead and do the same right there. And then go ahead and try to touch your nose to your chest and all the way back. Are you experiencing any pain or anything like that when you do that? Okay. The next thing I'm going to do is I'm going to observe your back. So if you would, go ahead and sit on this chair for me. Alrighty. So, as I inspect the back, I'm going to notice any asymmetrical movement. I'm going to notice for any accessory muscle use, intercostal accessory muscle use, etc., etc. I'm going to inspect, I'm going to palpate, making sure everything's in line right now. I'm going to place my thumbs at between T9 and T10, and I'm going to have Lincoln take a big deep breath for me. In and out, noticing for change in the angles of my thumbs and also symmetrical movements as well. I'm going to percuss the intercostal spaces of the back. And then I'm going to use my stethoscope, and I'm going to have him just take some nice big deep breaths. There are 10 osculation points in the back. All right, thank you very much. If you go ahead and return to your seats, go ahead and hang on to that for you as well. I'd just like to make a note that with this particular brand of stethoscope, it's a Master Cardiology. It does not have a bell; it only has a diaphragm. So we won't be able to observe anything with a bell today. All right. So at this point in time, I'm going to assess the anterior chest. I'm essentially going to do the same thing I did for the posterior side of the chest. I'm going to observe for symmetry and movement, also for any intercostal accessory muscle movement. As I'm looking at that, I'm also going to notice the rate and depth at which he breathes. And then I'm going to palpate the anterior chest and also observe the skin for any changes in integrity, as I mentioned before. All right, are you noticing any tenderness, pain, anything like that? Okay. I'd also like to take this opportunity, since I've got the stethoscope all set up and ready to go, I'm going to osculate his carotids for any bruit. Alright, so moving on to the heart. The heart has essentially 6 areas we need to concentrate on. The first of which is the apical pulse, which is at the fifth intercostal space at the midclavicular line. What we're going to essentially do right now is palpate for the apical pulse. We're going to observe that there's no irregularities in heartbeat, that there's no vibrations, thrills, and we're also going to observe for heart tones whenever we auscultate the different heart noises. We're essentially looking for an S1, S2, noticing if there's any S3, S4, or any other heart murmurs that we should be aware of. So go ahead and palpate for the apical pulse, observing any of those vibrations or thrills that we had mentioned before. And then the five points we'll be listening for the heart are the aorta, pulmonary, Erb's point, tricuspid, and mitral. So we'll go ahead and, as I said before, auscultate and then observe the heart tones for any regularities or irregularities. So we'll start off with aorta, pulmonary, Erb's, tricuspid, and mitral. And then since we got our stethoscope out, and we're going to go ahead and auscultate the interior of the thorax for any adventitious lung sounds, or to see if his lungs are clear. Since we already did that with the back, we'll go ahead and do it for the front as well. So just go ahead and breathe normally for me. Okay, good. Now at this point, we're going to go ahead and assess the abdomen. So Lincoln, if you wouldn't mind, just go ahead and I'll move this a little bit. We're going to need to have you put the chair in a reclined position. Okay. As I assess his abdomen, the first thing I'm going to do is I'm going to inspect. So essentially, make sure that the abdomen is flat, abdomen is in a flat position. Noticing any irregularities of skin. I'm especially try to ensure that we observe for any kind of pulsating masses, any kind of irregularities, hernias, ascites, etc., etc. That part's very important. When we do observe the abdomen, we're going to save palpation for last, because any kind of manipulation could cause any kind of irregularities in bowel sounds and things like that. So what we're going to do is we're going to inspect, then auscultate, and then percuss, and then we'll move on to palpation. So I'm go ahead and inspecting right now. Everything seems to be well within normal parameters. And then the next thing I'm going to do is I'm going to auscultate for bowel sounds. Anywhere between 5 to 30 clicks or gurgles per minute is considered to be normal bowel